Hello everyone, I'm Janet. My disease process is coronary artery disease, which is narrowing or complete blockage of the arteries that take oxygenated blood to the heart. This happens through a process called atherosclerosis. That is arterial wall linings becoming damaged through risk factors and losing their anticoagulant and vasodilatory properties. When this happens, plaques form. As the plaques grow, the blood vessels narrow and there's less oxygenated blood able to get through to the heart. This decreased blood flow and decreased heart supply over time causes tissue damage. Risk factors for coronary artery disease come in two categories: modifiable and non-modifiable. Non-modifiable we can do nothing about: age, gender, race, family history, and genetics. Can't change them. Modifiable risk factors include hypertension, hyperlipidemia, diabetes, smoking, obesity, poor diet, chronic stress, sleep disorders, and physical inactivity. We can change those and we can make it better. Diagnosing coronary disease comes through multiple ways. We first do an EKG and look at electrical activity. We can see where damage is occurring by the EKG waveform. Lab work, we look specifically at cardiac troponin. Troponin is a protein that is in cardiac muscle tissue. It is not in the bloodstream normally. When there is damage, it spills into the bloodstream and we measure it. The higher the level, the more damage that's occurring. We could do a CTA, which is a 3D radiological view of the heart and vessels, and we can see just a general glimpse of whether or not there are plaques in the vessels or narrowed vessels causing decreased blood flow. We can do an echo to determine cardiac function and valvular disease and see if the coronary disease has in fact damaged the function of the heart as well. If your troponin continues to rise, they will put you on heparin for blood thinning, and they will take you to cardiac cath. This is an interventional and invasive procedure where they feed a catheter through the femoral or radial arteries and take a look at the vessels from the inside. They can see exactly how much narrowing there is, how much damage there is. They can give everything a percentage and know where to go from there. If they can treat a small area of plaque and narrowing, then they can deploy stents. If they cannot, then they will refer you for coronary artery bypass through the cardiovascular surgical team. If you have a CABG, that is open heart surgery, where they take vessels from your mammary artery area as well as your legs, and they recreate roadways for blood to flow to the heart, completely bypassing the damaged and narrowed vessels. Once you go through that, you will start a new medication regimen with antiplatelet aggregators like aspirin and Plavix to continue to blood thin. They will start you on lipid lowering medications like a statin. They will start you on beta blockers. Beta blockers have many good outcomes. They decrease oxygen demand, they decrease cardiac workload, and through this they minimize future cardiac damage. They prevent arrhythmias and they decrease blood pressure. As well as a medication regimen, you will get a therapy regimen consisting of cardiac rehab, which is exercise specifically aimed at increasing cardiac strength and endurance, diet control, increasing general exercise, decreasing stress, lowering blood pressure. All of these things are lifestyle modifications that can help with controlling future coronary disease. I hope you've learned something through this presentation, and I wish everybody well.